Hello, thank you for joining us for this 15-minute webinar where we're going to discuss physical activity and cancer. My name's Dr. Helen Platts. I'm a GP advisor at the Wessex Cancer Alliance, and we're really lucky to be joined by Dr. Rebecca Gold, who I will let her introduce herself now for us.
Hi, I'm Becky Gould. I'm a physical activity clinical champion based in Hampshire and Isle of Wight, and work clinically as a sport and exercise medicine consultant doctor. So Helen, why will we be focusing on physical activity for this year's Wessex Cancer Alliance Local Improvement Scheme?
Thanks, Becky. We know that cancer is a leading cause of death in the UK, and also importantly, half of the number of people diagnosed with cancer will thankfully now survive at least 10 years after diagnosis. So we're really looking at cancer as a long-term condition. So we need people to be living well with those long-term conditions and living well with cancer. So we know also that physical inactivity is a really incredibly significant risk factor for many types of cancers, and we know that actually quite staggeringly 11% of cancers could be prevented if all adults are physically active. So there's really huge amounts of increasing evidence for the benefits of both cancer prevention and also living better following cancer treatment. So that's why we really wanted to focus on enabling primary care to help patients in all of the elements of cancer prevention, helping patients during their cancer treatment, having the confidence to do that, but also helping patients live better and living longer with cancer. So Becky, I wondered if you could help us here to sort of think about or explain what role physical activity plays in actually reducing cancer.
Yeah, so traditionally physical activity was thought to be associated with kind of 3 different types of cancer, so colon, endometrial, and postmenopausal breast cancer. But more recently, evidence suggests that physical inactivity could contribute to kind of up to 15 different types of cancer, so including kind of gastric, kidney cancer, and bladder as well as the other ones. I think what always strikes me when we talk about primary prevention and physical activity is how big an impact physical activity has. So if you're looking at colon cancer, when you compare the most active to the least active, you've got a reduction of cancer incidence by 30%, breast cancer 20%, and physical activity is a multi-system intervention. So as well as reducing cancer risk, we see reduction in other long-term conditions such as cardiovascular disease, diabetes, dementia.
I mean, it's so interesting, isn't it? I think if we had a drug that had those benefits and we were giving that out, it would be pretty successful, wouldn't it? So thank you. And looking at sort of the benefits of people who actually have cancer, are you happy to sort of explain a little bit about that to us as well?
Yeah. So when I think about physical activity in cancer, I find it quite helpful just to kind of split it into the different stages. So we've got the prevention element that we've discussed, but then also how it can help with people as they're going through kind of active treatment and help that kind of recovery in the short term. So if physical activity can help optimize people's physical reserves before undergoing surgery, undergoing chemotherapy, reduces complications associated with these things, reduces hospital stays, allows people just to kind of be active, do more at home. And when you're looking at kind of longer term outcomes, we've got strong evidence to show that physical activity can benefit things like cancer related fatigue, health related quality of life, function, anxiety, depression. So kind of multiple effects across different systems.
Yeah, really quite staggering, isn't it? And as far as kind of how we can tell what we can tell our patients, I think this you're going to describe a little bit about what's important to patients on this slide.
Yeah, so when discussing the benefits of physical activity, the aim is to try and make it meaningful for the person that you're talking to. So saying to someone that you might have a 20% reduction in cancer recurrence in 20 years' time may not be the hook that's needed for someone to think about their behaviours. There was a survey done by We Are Undefeatable, which asked people who are living with cancer, what are the main reasons why you're physically active? And the top 3 reasons that came out were to maintain physical health and fitness, to improve their mental health, and manage their symptoms. So if I'm having a conversation, I would probably focus on these things, and then maybe bring in some of the other kind of outcomes a bit later on.
Thank you. Yeah, I think it's so important, isn't it, to remember actually what's going to motivate the patient rather than us as healthcare professionals. Thank you. And as far as sort of how much, what should we be advising our patients, and also is that the same for patients with cancer? Should we be telling every patient to run a marathon, or how do we approach that kind of level and amount we should go for?
Yeah, so the kind of guidance for physical activity in preventing cancer for people living with cancer is in line with the UK Chief Medical Officer guidelines on physical activity. So this has a couple of different components to it. There's the kind of aerobic physical activity component, which is either 150 minutes of moderate intensity physical activity a week, or 75 minutes vigorous intensity physical activity. The difference between moderate and vigorous is kind of how hard you're working. So the poster gives some nice examples of kind of what counts as moderate, what can count as vigorous. Very intentionally in the centre is building strength on at least 2 days per week, because it's often a forgotten guideline and people concentrate on the aerobic side of things, but we know strength is really beneficial for helping maintain function, especially as people get older. There's also advice on reducing sedentary time, so breaking up periods of lying or sitting by short movement breaks, as well as improving balance 2 days per week for older adults. One of the great things about physical activity is that it's not black and white. It's not a case of having to do 150 minutes or not getting any benefits. There's a dose response curve, which is steepest at the start. So by getting someone who's inactive, so doing less than 30 minutes, doing 30 minutes plus 60 minutes, can have really significant improvements on their health outcomes, and gradually working towards the 150 minutes is ideal, but in terms of setting realistic goals, it's not necessarily always achievable for people. And I think the thing to remember, and what's highlighted quite nicely with this graphics, is that physical activity can incorporate things that are done day to day. So things like carrying shopping, going up and down stairs. It's not a case of having to don some lycra and get into the gym. It's about kind of building movement into everyday life.
Yeah, I think that's so important, isn't it? Because the thought of, when you bring up exercise to lots of patients, they think we're going to send them to the gym, and that's a lot of people's worst nightmare. So I think remembering, that actually just increasing what they're already doing or starting to walk around the block is a start, isn't it? Like you say. Thank you. And as far as kind of risk, I mean, often, we are quite scared as primary care team to advise patients who we might think are quite poorly, so undergoing treatment or even post-treatment, are we going to go and tell them to do something, and their oncologist will say, well, why has your GP told you to do that? That's really risky. Have you got any sort of information or kind of reassurance for us that we are okay to do that?
Yeah. So if we're just considering initially physical activity for people with long-term conditions, a consensus statement came out a couple of years ago and was published in the British Journal of Sports Medicine. And the main conclusions from this was that the benefits of physical activity outweigh the risks, even in people living with multiple long-term conditions. It also highlighted that the risk of adverse events is very low, but that's not necessarily how people feel. So having healthcare professionals having physical activity conversations, addressing people's concerns, giving reassurance is really important. We also know with physical activity promotion, it's not just as easy as telling someone to move more. There needs to be kind of conversations that kind of help build up someone's confidence to be active, help them kind of come up with a plan. We also know that everyone has their own starting point. So by helping people recognise where they're at and building gradually from there, it makes physical activity very safe. So if someone's baseline function is walking around the home, maybe going up, up and down a couple of flights of stairs, then the next step for them is probably looking at maybe going and taking a walk outside, increasing the distances slowly. What you don't want to be doing is advising them to, go to the gym, work vigorously when their baseline is a lot lower than that. So it's about, starting slowly, building gradually, and this is really safe. There are a few kind of medical considerations. So if somebody was to develop, very dramatic increases of breathlessness, more than you'd expect from the activity, new or worsening chest pain, problems with palpitations, irregular heartbeats during activity, dizziness, then those would be reasons to stop and seek medical advice. There's a few kind of cancer specific considerations as well. So I won't go through the whole slide as this is quite a busy one, but you could always pause the video. But there's a few questions to ask if the person that you're speaking to has cancer. And I suppose the main considerations to highlight is around kind of fracture risk. So if somebody has a bone primary or secondary, you might need to modify the activities that they're doing, avoid kind of high impacts, seek advice from their specialist teams if needed, and the same with some of the kind of abnormalities in blood counts that you may occasionally come across in primary care.
Perfect, thank you. I think we all know, and we all are experiencing the sort of time pressures of primary care and the difficulties, and even just sort of introducing anything other than sort of baseline. So we're obviously asking primary care clinicians to try and introduce this discussion, or sort of have more discussions regarding physical activity. Is there a way that you would suggest that we approach it in a sort of practical manner?
Yeah, so I suppose even just asking someone about their physical activity levels can be a really powerful step, and it doesn't necessarily need to take a huge amount of time. If someone's already physically active and have received a diagnosis of cancer, it may be a case that what they need is just permission that it's safe to be active. It will be beneficial for them to be active. They may need to make some modifications, but they can kind of keep going with what they've previously enjoyed. For other people, in terms of short conversation, using something like the very brief advice framework can be done in less than a minute. So this has different components to it. The first bit is around asking. So asking, for permission to have a conversation. Would someone be happy to spend a few minutes talking about something that might make a big difference to their health? And asking open questions. How much physical activity do you manage to do in a regular day, typical week? There's also, then you move on to some brief advice. So, somebody suggesting, people who've got cancer find that if they're active, they may notice improvement in side effects of treatment, improving the tiredness, and the benefits you can tailor to the person in front of you. You can also give a bit of advice on what to do. So it's okay to start slowly at a level that's right for you and build up gradually. The final bit is acting. So you could potentially invite someone back to have a conversation with yourself or a colleague, such as a social prescriber, health and wellbeing coach, around physical activity, or signpost them to some of the great resources that are available kind of online for people.
Amazing, thank you. And as far as of those resources, is there anything that we can kind of, help tie into these conversations, or anything that you could suggest is sort of, useful for us in primary care?
Yeah. So for healthcare professionals, there is the physical activity clinical champion training, which I deliver within Hampshire and Isle of Wight, but is also available nationally through the national team at Moving Medicine. As part of this local improvement scheme, we'll be hosting some open online hour-long physical activity clinical champion training, which is available to everyone via the Energize Me Eventbrite page. And if you're interested in setting up bespoke training within your GP practice or PCN, you can contact me if you're based in Hampshire and Isle of Wight, or contact the kind of central team if you're based in Dorset. The Moving Medicine website, which I've mentioned, has consultation guides, which can be 1 minute, 5 minute or more minutes for a range of long-term conditions. So this is really helpful for healthcare professionals having physical activity conversations. And for something a bit more cancer specific, Macmillan produced some really helpful guidelines.
Amazing, thank you. They're really exciting, and the clinical champion training sessions will be really helpful. Thank you. And as far as for our patients, are there sort of specific things that you recommend?
Yeah, so there's lots of different things available, and for local signposting, there's some we've made some extra videos for Hampshire, Wight and Dorset, just because the offer's different. But thinking a bit more nationally and what's available, the Real Undefeatable website's great for people with long-term conditions, including cancer, and they have a free app which can be downloaded by patients to give kind of bespoke physical activity activities to do at home. You've also got things like the Cancer Care Map for people who are living with cancer. Ramblers host wellbeing walks, which are very widespread across Hampshire, Isle of Wight and Dorset. And the Moving Medicine website now has a patient-focused and patient-centred part of it. So people can go onto that, find out more about their condition and physical activity. And there's also a kind of AI chatbot on there, which can do some motivational interviewing for you if you're a bit short on time.
Amazing. Thank you so much. All really, really helpful. And thank you so much for your time, Becky. It's brilliant.